Hello, everyone, and thank you for tuning in to Help for HDTV. Today we have Laura on with us, and she just recently did her first visit after she was accepted into the Sage Therapeutics trial, Dimension, and Surveyor as well, which is investigating Sage 718. Which is a phase 2 study. This looks at the possible future treatment for cognitive function in HD. The executive function is what they are actually targeting, and the executive function loss in HD impacts so many people. It makes people lose their jobs. It makes people lose their ability to drive. The list goes on and on of these losses. We have treatments for the movement of Huntington's disease, as we all know, and we do actually have effective off-label drugs as well for the psychiatric behaviors that work really well for the psychiatric features in HD. To have a treatment available for us to help with something for the cognitive part that our family members have to endure living with HD would be an incredible win for our HD community. To help with symptoms that takes away, when you think about your cognitive executive function, it takes away so much independence and quality of life. So this trial is very exciting. So we are very thankful for Laura coming on and talking to us a little bit about her experience with this trial investigating Sage 718. So Laura, let's first welcome and let's first talk about, have you actually enrolled in the Dimension study or the Surveyor trial?
I am in the Dimension study.
Awesome. On that note, with all the different studies, trials available right now, what made you specifically want to seek out this trial?
First of all, I had a friend who was enrolled in North Carolina in the trial and actually told me about it. And it was basically the first drug trial that I qualified for with the stage that I am at in my disease progress. I have been in clinical trials before that studied things like PET scans and how contrast material affects HD brains, things like that, but nothing that actually involved taking or possibly taking a medicine that would improve any of my symptoms.
So why don't you, Laura, walk us through those first clinic days?
There was the screening visit, which basically was, there is a research assistant assigned to you, which is great. She meets me in the lobby when I walk in and walks me out the door at the end of the day. Basically, there was just a lot of cognitive tests that day. For example, she would read a list of words and then immediately ask me as many as I could remember. And in the middle of that, there were some other tests on computer and on paper, connecting dots from numbers to letters, drawing lines like that. Then a few minutes later, she would come back to me and ask me to list those words that I had got initially in the list. There was a total of 3 times that I was asked to repeat those words back to her. And boy, did I not feel like I was doing a great job in that. I felt very supported after every test or task I did. She tells you good job. She explains everything really well, what's expected of you, if it's going to be timed. I just thought it was a day that by the end of the day, I was a little tired. I felt like I had used my brain for the first time for several hours at a time in a while, but it wasn't that bad. And
That's good.
They include transportation, so that's a huge thing. I live in New Hampshire. I would say about an hour and a half away from Boston. So when I first heard about the study, I was excited, but driving to Boston, everybody hates doing that around here. So the fact that they send a really nice car and I don't have to worry about anything. I just get in it and go. And they're waiting for me at the end of the day. That was the screening day. Once I knew I had been accepted into the trial, they had day 1 is broken up into 2 parts. And basically, the first part of it is doing pretty much all of those tests and some additional ones, the cognitive tests. There were some additional ones that were on computers, things like putting how many moves does it take to put these circles in the same arrangement as they are on the screen. Very easy things, but I'm sure the data that they get from that tells a lot of how far along I am in my disease. The second part of the first day of the trial is basically medical: height, weight. They draw blood, they take a urine sample, they ask that you not have any alcohol 72 hours before. So there's even a breathalyzer test that they do to make sure everything is the way it needs to be. And I actually just this day before yesterday just took the first, either the active drug or the placebo. I took the pill while I was there, and they send you home with an app that you use that reminds you to take it at the same time every day, which is really helpful, especially if you don't happen to take medicine in the morning. So that was how the screening in the first day went. The next time I go back in, it's going to be, I believe, a shorter visit. And and then the visit after that, I'll have the cognitive tests again, as well as taking the drug while I'm there.
Was that like a long clinic day? I'm curious if it was like, was it 8 hours? Like how many hours did that take for
They
the
actually,
first part?
for me, what they called it like day one, but it was broken up into 2 days. The first day was it was only about 3 or 4 hours of the cognitive testing. I stayed overnight in Boston, and then the next day it was a few hours. I would say it was even shorter, 2.5 hours. Just they had to wait for some of the lab work to come back. So I had a little bit of time to read a book. The people are so nice. My research assistant sits with me most of the time. There are, even going a few times, there are nurses that I'm already getting to know, the receptionist. It's a very upbeat group of people, especially where I go. But you sit and chat with them a little bit while you're waiting for the results, or they wait for the drug to come down from the pharmacy once they order it. That's pretty much, it wasn't bad at all. It definitely could have been done in one day, but I know that for some reason they break it up into two shorter visits.
It sounds like there was a lot of support. Were there any other supports that you didn't mention other than the person that assisted you to walk you through the day and answer your questions, things of that nature, transportation?
The transportation people have been just amazing, making sure I knew everything was all taken care of. I did have a doctor that came in to do an exam. Most of us who have HD are used to certain exams, look at my nose and look at where I'm snapping my fingers, walk down the hallway. Normally walk down the hallway with your toes, right up against your heels. That doctor was amazing. Also, he went into some history of some of my psychiatric symptoms I've had in the past, as far as depression, because one of the side effects of the drug is depression. So they wanted to make sure that I'm supported if I do get the active drug and I do have that side effect. I felt like I could ask him any question. I saw him both during the screening and on day one before I took the medicine or the placebo.
Sage is very different because they have like come up with their own outcome measures. Of course, they're using a lot, as we hear you talk, a lot of measurements that have been used over time, but there's also some specific measurements that they have come up with themselves, which I think is actually incredibly smart. I think our measurements are probably going to need to be revamped. So I think that's great that they've done that. But going through the test, did you feel like they were asking you the right questions? Do you feel like I think we often hear that they're asking questions that are confusing for people. So do you feel the questions were very straightforward, where you were giving the answers, really showing them where you are cognitively at baseline starting this trial?
I did. And there weren't as many questions. That it was more the tests. that they did that showed me, for instance, when they read that list and I had a hard time after, forget when she asked me 10 minutes later, I could barely remember any of them. The tests that they were doing showed me that they were really kind of honing in on what my issues are, remembering things, even if somebody just said them. They did tapping tests, having you try to keep up with tapping noise on the computer. And you can hear when you're doing it if you're off, which I could clearly hear that mine was off. So I felt like they were really honing in on measuring things that I definitely have a problem with. Just the general questions that they asked me too were very specific to problems I have as far as recalling things I hear only a few minutes ago, or just in general things about things in life that I do struggle with. But there weren't like a ton of questions that I felt didn't apply. Everything I felt applied to me. So I knew I was obviously in the group that they were looking for. Before they even told me I was accepted to the trial, I could tell by the questions and the tests that I didn't know, maybe I was too bad. Maybe I was too far along, but apparently I did fit into the criteria they were looking for.
Some of the tests that they're doing, like the way you're doing them and repeating them and having to really concentrate on them, do you feel like they're getting a really good understanding of how you're doing, what your baseline is, as you mentioned, right? And then if you are on drug, like how maybe your cognitive function will improve? Do you think that will be easily measured with redoing tests later on?
Yes, and I think it'll be interesting, even if I'm not on the drug, it'll be interesting to see if the placebo effect works at all too. If I go in there next time and I do a little bit better, and maybe I'm not on the drug, I'm interested to know that too. I think that the way that the testing is done, I think they're going to have data points that are very easy to see if there's improvement. Don't feel like I'm wasting my time at all doing it. It might be a little monotonous at times, but I definitely didn't feel like I was wasting my time doing any of it.
Yeah, I think this surveyor study is so interesting to me, like those driving simulators and everything that they're bringing in. They have really taken a lot of time to truly understand the fine details of cognitive function. Obviously, you have to be in that surveyor area because these simulators and stuff aren't everywhere. I would assume they're very expensive.
Now that I've been in there technically 3 times, they have a bunch of, they hand me a tablet and ask me specific questions. Within the past week, have you felt like this or that? Within the past week, have you had a hard time remembering this or taking care of just daily things around the house? So I think that will get a lot of good data as the study goes along too.
So talking about the placebo, you brought up that word. So I know that being a part of a clinical trial, it's probably so frustrating not knowing if you're on drug or not. And you're probably looking at every single detail wondering, does this mean I'm on drug or not? So talk a little bit to us about placebo. And can you explain to us in more detail kind of how you feel about being a part of a placebo study?
With the placebo, basically with this study, you have a 50% chance of getting the active drug. You have a 50% chance of getting the placebo, which is no drug. I know myself, I asked a lot about some of the side effects, and the side effects on this seem kind of mild. I was hoping they would be more pronounced so that if I was on the active drug, I would know. I joked around 5 minutes after I took my first dose. I said, "Oh my God, I feel different." I'm just kidding. I'm just kidding. Like, it, not knowing does drive me nuts. And I came home from the first day of the study and I took a nap for 4 hours. And I immediately thought, I wonder if anybody else napped. Is that normal? Or is it just because I was in Boston all day? I don't know. So it's frustrating not knowing. It's not frustrating to me though, knowing that I could even if I'm on the placebo, I think I'm going to benefit from the study, because once the period is over, it's basically 112 days. So once that 112 days is over, I then have the option of going into the study, the extended study, where for a year I will be guaranteed the active drug. 112 doses of medicine, that's like 3.5, 4 months. That's not a long time. So as an inpatient as I am, I can handle waiting that long.
Yeah, you mentioned a little bit earlier about 1 year nap, but to just the brain workout that you did during the clinic, how did you feel like following it? Like the next day, how were you feeling?
I did feel like I had used my brain more than I would on a normal day. I don't work right now, so my normal day at home doesn't have to do with a lot of tasks that exercise my brain. When I came home, even the first day of screening, one of my family members asked me to do something for them on a computer, and I was like, I've had a day using my brain today, so I'm going to do that tomorrow. It wasn't anything awful, but I wanted to just sit and watch TV and chill. I wasn't looking to come home and start working on a project that was going to need my full brain capacity. So it wasn't awful, but I definitely was a little brain pooped when I got home.
Oh, do you have any final thoughts before we wrap up the show? Anything else you'd like people to know?
I don't, I think it's important to say that I believe I mentioned that there is transportation for the study, which it's really nice to be able to relax, chill out, listen to an audio book, and go to the appointments. The thing that I did not know until I had done the screening day was that it is paid. There is a stipend that you get per each visit. That was thrilling. I'm not going to lie. Christmas is coming. I guess that's something important, I think, that I would want to say, especially if somebody was wondering if they wanted to do it or not, if they were going to get the placebo, if it was really worth it to be doing it. Some extra money. Everybody needs some extra money. I think that's basically it.
Thank you, Laura, for what you're doing for our community. I just thank you, everyone who participates that's listening. Also, it's a big deal. It's something I definitely can't do. I just appreciate you choosing to participate.
Thank you. I'm glad to do it.
And also, I'd like to mention that Lauren Holder, our producer and radio show host, she's very open about her journey, and she's doing the radio show about her journey on Help for HD Live. So if you want to learn more about the study, like in getting two perspectives, and interestingly enough, I've heard both, and they're very similar, that they feel very supported. They're glad that they've enrolled in this study. But yeah, so you can also go to Help for HD Live, and you can follow Lauren's journey as well. We are going to catch back up with Laura on our show for sure, if she's willing, as this proceeds and moves forward. I would love to get
Absolutely.
into especially after your second visit. That would be awesome. So thank you, Laura, for participating in research. The only way we are going to have treatments and therapies in the future are because of individuals like you. Thank you to Sage Therapeutics for truly listening and understanding that the support that's needed is being offered through the transportation, through the escort meeting you at the front of the building. They have really taken the time and listened to the community's voice and need to be supported through this clinical trial. So thank you for understanding that partnership and making those support services happen. We hold tight to the hope that soon we will have a drug available for cognitive and executive functioning in HD, and hopefully we will find out soon. And thank you for mentioning the extended open label. I think that's something that's not talked about enough, that there is the option of going on to the open label after the study, like Laura said, which is what, like 4 months?
Yep.
So that's huge. So I think until next time, do not forget to this video and subscribe to the channel below and ring the bell for notifications. Till next time.